Happy Tuesday. We are here for another Cheeky Chat, Cheeky Chat Tuesday, and this week we're actually going to be talking about C-sections. So I titled this video The 5 Myths That I Hear About C-sections as a pelvic floor physical therapist. And then we got a few questions that came in on Facebook for the Q&A part, and so I'll dive into those right after these 5 myths. Okay, so myth number 1 is that after 6 weeks post-op, that you are good to go back and do whatever you want to do. So like whatever kind of exercise you were doing, whether it was CrossFit or training for a marathon, you're good to go. And that's actually not true. And the reason why it's not good is because you just went through a major abdominal surgery and the recovery is really tough. And so jumping right back into whatever physical activity you were doing beforehand can actually put you at a greater risk of some sort of, whether it's like injury, like re-injuring something, or it doesn't have to be exactly like core pelvic floor related, but it could be. So different pelvic floor issues like leakage, prolapse, diastasis, even like at 6 weeks, your incision, some incisional issues there too. So when you think about what layers of your body that the surgeon has to go through to get to be your baby, it's like 6 layers. So layer 1 is obviously like the skin, and we have a visual. I will link the actual video of the visual in the comments below. But 1 is the skin, so the doctor has to get through that. Next is the fascia, so that's just like connective tissue in between like the skin and the muscle. And then the doctor has to go through the abdominal muscles, so that's number 3. And then your doctor has to go through the tissue that lines the organs. And then after they go through that layer, they have to go through the uterus and the amniotic sac. So it really is a pretty major abdominal surgery, and not rehabbing appropriately afterwards can lead to issues in the future. If you think about back to the ACL example I gave a few videos ago, if you look at the rehab protocol for after an ACL repair, it is so hold on, I got a notification from Facebook to close out of some other apps. Okay, it is so important to rehab after an ACL, and compare an ACL surgery to a surgery where they cut through your organs. It's a totally different level having an abdominal surgery. So why aren't C-sections being more appropriately rehabbed like an ACL repair? I don't know, but we're here to change that. Okay, so that's myth number 1. Myth number 2 is that if you have a C-section that you will not have any pelvic floor issues because you didn't give birth vaginally, and that is completely false. Because, well, 1, you went through 9 months of pregnancy. That means your pelvic floor was under a lot of demand and it was being overworked and overused for those 9 months. So you can 100% still have pelvic floor issues just from that alone. Now, the other side of it is some people have had a cesarean. Maybe they had an emergency C-section, or maybe they labored. They did labor some, and so even like laboring partially and then having a cesarean can cause some pelvic floor issues postpartum. So some people, you get a lot of people asking like, hey, if I had a C-section, like, do I even need to see a pelvic floor therapist? And the answer is yes. You still do. And we'll get more into like what else a pelvic PT would look at anyway. So that's number 2. Number 3 is all about the C-section shelf that people talk about. A lot of moms that we see talk about the shelf and like wanting to get rid of it. And I'm here to say that it's not fat, it's the scar tissue is creating that shelf look. So let's say For example, we'll just use my hands. So here is like the top of the, above the incision. This is the incision. This is below the incision. If you think about a scar, it's going to be curved like that. This is a terrible example. Hold on. Here we go. Got a better idea. Okay, so pretend this is your stomach, and pretend this cord is the scar tissue, the incision. So if you look at how the incision makes the balloon kind of like go convex above and convex below it, so that is what causes the shelf look. It's the scar tissue doing this versus just that. And so the goal of the scar tissue, and this is what we work on in pelvic floor PT, is actually getting the scar tissue to let go so that it's not creating that shelf appearance. And more than just appearance, that scar tissue can cause a lot of issues with bladder urgency, bladder leakage, even tailbone pain. One of my mentors, she had a patient who had a C-section and had tailbone pain, and they did all sorts of treatments for the tailbone pain, focusing on the tailbone. And then my mentor decided to start working on the C-section scar. After they started working on the C-section scar, that's when the tailbone pain got better. So that's just a little story of what scar tissue can, how big of an impact scar tissue can actually have on your body. Okay, so that was number 3. Number 4 is about VBACs. So VBAC stands for vaginal birth after cesarean. There are, previously in our parents' generations, a VBAC was very uncommon, and a lot of doctors wouldn't allow you to do a VBAC. So once you had your first C-section, that's the only way that you could deliver. But now there are a lot more doctors who are open to a VBAC, and that doesn't mean that because you had a C-section the first time and you don't want to do a VBAC, that's not a bad thing. That's okay. So the main myth is that you are able, if you want to have a vaginal birth after a C-section, you are totally able to, unless there is some other medical reason why you can't. Okay, the number 5 is that with a C-section, it's very cold and you don't have a lot of options and you can't do skin to skin. That is actually false. So there are things called a gentle cesarean, and that's typically when it's a planned cesarean delivery. You can adjust the lighting, you can have music, you can have skin to skin, you can have a clear screen so you can actually see when your baby's delivered. I think there's a part that's opaque, and then it's the screen, so you're not going to see everything, but you will be able to see your baby pretty immediately. So yeah, those are the 5 myths about C-sections. Now, we got a couple of questions about it. So the first question that we got is it possible for feeling to come back over time, or is it possible that you will always have numbness there forever? And that's referring to at the incision level. So first, we have to understand why that numbness happens. So numbness at the C-section scar happens because nerves are cut and damaged during the surgery when they are cutting through the layers to get to your baby, or they're stretched. And so keep in mind that when it comes to a nerve injury, your nerves, they grow back at a rate of 1 millimeter per day. Tiny, tiny, tiny. That's about 1 inch per month. And so it takes a very long time for nerves to grow back. And if there's scar tissue deep in the incision, that's going to prevent the nerves from being able to grow back the way that they want to or should. So, and another thing to note is that numbness, tingling and burning is a sign of nerves regrowing. And so if you do have that is a sign that they are regrowing. Typically, we'll see that people over time, and it kind of varies. So some people will get feeling back within 6 months. Sometimes it takes a year. It really just depends person to person, but you can 100% get feeling back there for the most part, unless the nerve damage was very severe, then that might change things a little bit. But if you are having numbness, one thing to think about is there any scar tissue here that I need to work on to help promote nerve growth. Other things that will affect nerve growth will, one, be the extent of the nerve damage, two, the scar tissue. So there's scar tissue that's going to definitely inhibit that growth. Your sleep quality, like, is your body resting and getting enough sleep to help the nerve regrow? Your nutrition, blood flow to the area, and exercise, and inflammation at the site, and in general, inflammation in your body. So these are all the things to think about from a big picture perspective when it comes to nerves healing. Okay, so that was about numbness and the C-section scar. The other question was, do you have any information on silicone scar patches? So patches, I can link what they are below. Maybe some of y'all have seen it before, but basically it's a silicone. Sometimes it's tape, sometimes it's a patch, and you can put it on your scars. It doesn't have to just be a C-section scar, but you can put it on a scar to help with the healing process. This tends to, a lot of research shows that you have to use it for like 2 to 4 months consistently for it to really show a change, which is a very long time and kind of hard for some people. But you can start using it as soon as the incision has closed up and has begun healing. And the way that it works is it prevents excessive growth of scar tissue by keeping the tissue soft and hydrated, and it stops the blood flow to the wound that lays down all the scar tissue. So that's a little bit about silicone patches. I personally haven't had a ton of patients that have used it, just an anecdotal personal experience, but I do talk about it and recommend it if someone can commit to using it for that long. And you can find them on Amazon too. There's a lot of different brands of silicone patches. Okay, the other question was C-section shelf help. So more of a statement. But this person said, planning on trying for baby number 2, right now 2 years postpartum. Are there any things I should be doing before and during pregnancy? Yes. So, things to think about. Are you planning on having a repeat cesarean delivery? Are you planning on having a VBAC? These are different things to think about. Either way, whichever one you choose, you really want to work on the scar tissue that you have right now before getting pregnant, because during pregnancy, we don't really recommend working on it then at that point. So you really want to work on it before you're pregnant. This is helpful again for both C-sections and VBAC, because for a repeat C-section, you don't want the scar tissue that is going to happen from the second C-section to build on top of the first one. You want to try to work on it before the second one. And then for a VBAC, same thing. You want that scar tissue to be soft and malleable and not hard and inflexible. And then other things not specific to the scar is just general, like exercising, strength training, work those abs, work the glutes, do pelvic PT before you try again and during your pregnancy. Prepare your birth team, know who's going to be on your birth team, and have those supporters in your corner are the biggest things for preparing for a second pregnancy, which is super exciting. But number one thing is please work on the scar tissue before you get pregnant again, and get strong, as strong as you can. Okay, I actually think, those were all the questions. One little side note when it comes to scar treatment, because what does that mean when I say work on the scar tissue? Well, what that means is scar massage. You can do that yourself. You can go to a scar massage therapist. We have one here in Wilmington. You can do cupping therapy, which we do in the clinic here. And we also do dry needling. for C-section scar tissue, and with electrical stimulation, which can really help to get that scar tissue to let go and release, to help it heal. That will help the appearance of the shelf, but also help any symptoms that you might be feeling because of the incision and the scar tissue. I want to tell a little story too of this one patient that I had a couple years ago who was having a lot of bladder urgency, and she was just feeling a lot of pressure on her bladder, and she couldn't really explain it, and it never went away. She even had done pelvic PT before, but didn't really see any change with her bladder urgency. And we worked together for a while. We did all of the scar tissue things. We did the scar massage. We did the scar cupping. And then finally I was like, hey, let's try some scar tissue dry needling. And after only 1 or 2 sessions of that, she told me that the urgency and the bladder pressure that she was feeling had gone away, actually. And she'd been having that discomfort for about 5 years. So that's incredible. And then another story I wanted to share is I had another client. This was probably also like 2 years ago now, about the same time, who had a C-section, and she was struggling with some abdominal issues and abdominal separation, so diastasis or diastasis, whichever one you want to call it. And she had also been to pelvic PT before. They had never done an internal exam. It was all focused on like ab work. So I did a pelvic floor assessment, and we found that even though she had a C-section, her pelvic floor was super overactive and overly tense, and that tension in her pelvic floor actually was pushing more pressure out to her abs, making her diastasis look even more prominent than maybe it was without that extra pressure. So we worked on her pelvic floor, we rebuilt her core, and that really helped to begin healing that abdominal separation. So that's another story that I wanted to share, just about things that you might not think about would come up for you because you had a C-section. So I hope that helps. I will post below a video that shows the different layers of during the abdominal surgery, like what happens. And then if anyone has any other questions for me, please just comment below this video, or post in the group, or private message me. Thank you guys. Happy Tuesday.